Hi, my name is Lorcan, and today I'm going to show you how to reformat PACS images as video, and hopefully we'll also cover why this might be an interesting thing to do. It's often said that a picture is worth 1,000 words, and this is certainly true, particularly in fields such as surgery, which rely heavily on visual understanding and spatial relationships. But how about 1,000 pictures? In the modern hospital environment, we consume images by the thousands several times a day. It is almost impossible to communicate with words or even pictures the full richness of that information to our colleagues. The role of radiology has become central to everyday surgical practice. Imaging is not only pervasive in the workplace, but is also a staple of presentations at surgical conferences and in medical education. Oftentimes, the imaging modalities we rely upon the most are cross-sectional or dynamic studies, such as CT, MRI, or fluoroscopy. As I have already mentioned, it is difficult to capture the essence of these three-dimensional studies using prose or still images. So how can we make things better? I propose that electronic video is an ideal format for quickly and effectively diffusing cross-sectional and dynamic radiology. If we think about a CT, for example, it is a series of images, each slightly different than the last, presented in series. This is the same core concept that animates video. In the past, consuming images as video would be awkward and time-consuming, but with the ubiquity of computers, almost everyone now has ready access to a platform for creating and consuming digital video. This may have particular value in settings where images are unavailable off-site, where there is no access to portable viewers, or where there is rapid, clear communication required between sites without a dedicated online sharing facility. It also provides another medium for publication with incredible scope for growth and exposure. This is likely to be an expanding feature for academic publications, like for example the Colorectal Disease YouTube channel. So how can we start to use this? It depends on your hospital's IT setup. It is possible to export studies directly as video from some viewing software, but where that's not the case, you have to make it. This isn't as daunting as it sounds. In our institution, the software allows us to export cross-sectional and dynamic imaging as stacks of JPEG images. And once you have the images, there are many software packages available for making and editing video. The most important thing when picking one is that you find it easy to use. I don't have an affiliation with anyone who produces video software, but I'll tell you a little about the package I use. It's called AVDMux, and it's a free and open source video editing program. It is compatible with a variety of common proprietary and open source video formats. And video creation has 5 simple steps. You open the study on a hospital PACS viewer and export the selected series to a USB drive. You then access the images on a separate device with AVDMux installed and create your video. I'm starting with a stack of JPEG images exported from our hospital PACS viewer. Note that the system gave us the option to strip out the text overlay from the images during the export process in order to protect patient confidentiality. The export process has also numbered each of the images in sequence. To create the video, all I have to do is open up our video editing software, then open the first 2 images in sequence, resize the window, and pressing play creates a video seamlessly from the remaining images. In order to keep it, it's as easy as saving it. And then if I close the program, we can see our video running smoothly in an alternative player. There are some advantages to this solution. It's free software with no license fees or ads. It utilizes existing hospital infrastructure, and it's compatible with any PACS viewer that can export a study as a stack of JPEG images. Deployment also scales easily. The free license allows for distribution of the editing software to any students or doctors who might be interested in using it, even across multiple institutions or in other countries. To recap the advantages of digital video, it has multiple applications as a communication tool to facilitate discussion with off-site colleagues and specialists working in other centres, and as an educational aid, a streamlined way to present cross-sectional and dynamic radiology within PowerPoint. It also has other advantages. If you were able to create video, this facility is available to you 24 hours a day, 7 days a week, without relying on services within the hospital. It also creates files that are simple to share, often creates modest file sizes that you can attach to email. It also displays readily on iOS and Android devices, which means it can be consumed anywhere. I'd like to finish by emphasizing that this is not meant to supplant the expert opinion of a radiologist, with specialist knowledge and access to high-quality image viewing software. Even so, having access to cross-sectional imaging in a naturally consumable format is a useful adjunct to communication in professional and educational settings.